My name is Tracy Christner. I'm the executive director of an organization called Empath Choices for Care. We're part of a big umbrella organization called Empath Health. And there are many organizations under that umbrella, like Suncoast Hospice, PACE, there's a home care program, so you can see there's kind of a theme there. And what our organization does is we help the community and the professionals who serve them with healthcare decision making. That includes choosing a healthcare surrogate, filling out living wills, teaching professionals how to facilitate conversations about these important things. So we not only work with the community in doing a lot of outreach, but we also work with the professionals because that communication has to happen both ways. So that's a little bit about what my organization does. We've been in existence since 1999, so we've been around for a long time. And we were founded by a cardiologist who I say had a life-changing moment. Often small nonprofit organizations are founded because somebody had a life-changing moment. His name was Dr. Lofty Basta. He left the hospital one night. He got paged back in for a code blue. Somebody had stopped breathing. And he was paged in to do what he does. He went in and he went to work on this fella and he saved his life. And he left that night, and he talks about it in his book, about when I left that night, the moon and the stars had aligned for me. Because he felt pretty good. He had saved somebody's life. He came in the next day to check on Mr. Jones, we'll call him. And he kind of expected the, hey, doc, thanks for saving my life. But what he was met with was some open hostility with, what did you do to me? I was ready to make my graceful exit, and now I'm here on this earth with a lot of wires and a lot of medication and a lot of things I never wanted. And that was his life-changing moment. And it hit him that, here he is, he's this doctor who's been trained to save lives, and not everybody wants the kind of care that he provides. And so what he did is he created this think tank of professionals, of attorneys, of doctors, ethicists, clergy, to talk about this thing called advanced care planning and decision making. And so a lot of what I'm going to share with you today comes from our history of sharing that information. You as potential healthcare surrogates, how many of you know that you already are somebody's healthcare surrogate? You are their decision maker. Okay, most of you, good. So we're going to talk through exactly what that means. I want to help you be a better healthcare decision maker because unfortunately, we tend to think it's a very small thing, and it's really not. And there's ways to be a better healthcare decision maker in getting to know that person that you're making the decisions for. So let's get started, and I encourage you all to ask questions as we're going. You don't have to save them to the end. Go ahead and ask whenever you need to. I've handed out some materials for you, and we'll talk about particularly the smaller one at the end if we have time. The other two that I've given you were from my presentation earlier today. This was to the patients about healthcare decision making and choosing a good decision maker. Is where we headed with that one. And so I will tell you all how to be a good decision maker, and I was telling them about how to choose a good one. And these are the materials that I shared with them, but I really think it's relevant for you all to have that just as much as it was for them to have as well. For those of you that just came in, let me just pass a couple more out so we're all on the same page. Here you are, sir. Alrighty, and we're just starting, so. Okay, so here's our objectives, what we want to do today. We want to discuss what a healthcare surrogate is and what those responsibilities are. Okay, so you understand what the legal responsibilities are, what makes a good one. We're going to look at techniques, how to make you become a better healthcare decision maker. We're going to talk about some of those really important questions that you need to ask. We're going to talk about strategies for getting support from others. This is a role that you may be needing to ask for some help while you're the one making decisions for someone else. And I'm here to tell you there is support out there for the decision makers. All right, so the first thing that I want to do is I want to look at a couple of terms. And these are terms that are typically confused out there, and just to get us all on the same page. So the healthcare surrogate is a trusted person who is chosen by the individual to make medical decisions. And you'll see why I have the word chosen underlined in just a second. Or the proxy, a healthcare proxy, is an adult who has not been expressly designated, but is authorized to make healthcare decisions. So in other words, there is no healthcare surrogate chosen. We assign them a proxy. Now what I will tell you is in the hospitals, they use these terms interchangeably. I'm constantly correcting them. The chosen person is the surrogate, the designated person is the healthcare proxy. And why there's a really important difference here is think about it from your own perspective. Wouldn't you rather choose the person who's making medical decisions for you than to have the state of Florida assign someone? Absolutely. These are very important decisions that we should be able to choose who makes those decisions for us. Some people don't want to do this. They don't want to choose a healthcare surrogate. That's fine, but you'll be given a proxy. And that's somebody who will be, according to the law, chosen to make those decisions for you. And there's an order for that, and we're going to talk about that in just a second. Yeah?
You mentioned in the state of Florida. Is it state by state?
That's a great question. I'm so sorry, because I know in my first group only 5 people were from the state of Florida. I'm from Florida, so I tend to reference everything from Florida. Every state in the United States, including Canada, has advanced directive laws. They're very, very similar, but there are tweaks and changes to them. So if you're from a state that's not Florida, it could be a little bit different for you. So all I would do is encourage you just to check into the laws of your state. But every state has advanced directive laws. And most of them, the tweaking happens about how you make it legal. And so that's what I would encourage you to look for. We're going to talk about that in just a minute. There's not a lot of changes. They're very, very similar, but they're small changes. Great question. Thank you. Durable power of attorney. I could probably talk for hours and hours about durable power of attorney. Here in this state, we've recently changed our power of attorney laws. In 2011, they changed. Just for my reference, how many of you are from Florida? Okay, probably about 3/4 of us. So the durable power of attorney, durable meaning it's not affected if a person becomes incapacitated, and it lasts until the death of the person who gave it. Once upon a time, we had these things called powers of attorney. And what happened is when a person became incapacitated, those powers ended. Well, what good is that? Because you don't need help for the most part when you're able-bodied and when you have capacity. But when you lose capacity and you need someone to be able to pay your bills and do your banking and things like that, that's when you need the help. So they made this term durable power of attorney. Now, because the power of attorney laws changed in Florida, Floridians no longer can walk into an Office Depot and pick up a power of attorney form. You used to be able to go in, it was very simple, you got it notarized. Now, the power of attorney is about 1/2 inch thick. And you say, oh, another big, thick power document that I have to go see an attorney for, but there's a reason for that. And the reason that it gives you a lot more protection, and it gives the person who's giving these powers a lot more detailed ways of giving those powers out. And what I mean by that is now you have to designate every single power that you want your durable power of attorney to have. So if you were somebody's durable power of attorney, they might initial, yes, you can access my checking account. Yes, you could sell my home. Yes, you could make medical decisions for me, and etc. There's pages of them. But what's nice about that is it's very detailed, it's very explicit. The banks require it now. because you know those general power of attorneys could be abused. And in our state anyway, with seniors, they were abused quite a bit. You heard stories of powers of attorney selling their homes out from under people. You can't do that so much anymore because they're very, very detailed. Was there a question? Yes, ma'am.
If you've got an older power of attorney, then should those be updated?
They should be, but in most cases, they're still honored and legal. It's just the banks are looking for the updated, or they're looking for the updated forms now. So you just might want to check and make sure, because you don't want there to be an emergency situation and them say, well, that's old and outdated. For the most part, they were grandfathered in, though.
And is there, this says until death, I happen to have been durable power of attorney for my mom in a different state earlier this year. She passed away, and we were questioned because the durable power of attorney was more than a year or two old. They were giving us a lot of conflict. And that's not when you need somebody
Right.
down on you saying it's not in effect.
Right.
So I wondered, were they correct in saying that it should have been, even the durable needs to be updated?
I don't know about every single state. I know in our state, and I see clients that are bringing durable power of attorneys that were written in the 90s. And in that case, that's a pretty old document. Chances are you have a lot of different feelings about how things should and shouldn't be done. So I would recommend updating it. If it's just 2 years old, I think that's still pretty new, in my eyes anyway. I mean, anything in Florida that was done after 2011 is under the new durable power of attorney regulations. So I'm not sure why they gave you a hard time about a 2-year-old one, but I don't know how every state operates. But that's a good point that she makes, is you don't want to be dealing with this whenever the crisis is going on. You want to know ahead of time that it's going to be honored. It's only for financial unless medical is specifically spelled out in the durable power of attorney. And the reason that I put that up there is because I also do work with nurses and social workers, and I say to them, just because a family member is waving a durable power of attorney under your nose does not mean that they have access to medical records and decision making. It has to say in that durable power of attorney that you have the right to ask about medical decisions, because most power of attorneys are about money. It just so happens that in the durable power of attorney, at least here in the state of Florida, we also include a section on medical decisions. Here in Florida, we have a designation of healthcare surrogate form. Some states call it a durable power of attorney for healthcare. But here, for those of us that are in the state of Florida, you can designate a healthcare surrogate without seeing an attorney. It's absolutely free of charge. And you all have copies of an advance directive in the booklet that I gave you, so you can see that for yourself. This is not something that requires any money to do. Okay, so you're sitting there and you're thinking, I don't know if I need to do this or not. Well, not making a decision is making a decision. So if you've decided, I don't want a healthcare surrogate, or someone that you're caring for says, I don't want a healthcare surrogate, that decision will be made for you, just like we talked about the proxy in the earlier slide. In the state of Florida, and most states I can tell you are not very different from this, so this pretty much pertains to all of us. Florida will appoint somebody to make decisions for you, and it's in this order. So say it was me, and I was the patient, and I didn't choose a healthcare surrogate, and they said, okay, we're going to determine who her proxy is. Does she have a spouse? Is the first question that they're going to ask. If I say, no, I don't have a spouse, they're going to say, does she have any children? And I'll say, yes, I have 4 children. How many of you have more than one child? Have you ever known them to agree on anything? Would you want them in a situation where they were assigned to do this, to have to make medical decisions for you and agree upon it? Because the state says that they're the next people that will, if your spouse is not available, or too sick to do this, your children are next in line. And what they say is a majority of the ones that can be reasonably gathered will make these medical decisions. Okay, so say I didn't have any children, they would say, do I have parents? Well, what if my parents are in their 90s? I don't know that I want to ask them to make life and death medical decisions for me. And you see it goes on to adult sibling, adult relative, close friend, clinical social worker. Now the reason that I have court-appointed guardian off to the side is that for most of us, we're not going to have a court-appointed guardian. That happens in some circumstances, but for most of us we won't. But just know this, that if you do have a court-appointed guardian, whatever the judge says rules. I mean, that would take precedence over all of this. Okay? Now, the problem with this hierarchy is it doesn't work for everyone. We have situations where the husband and wife may be involved in an abusive situation. Maybe she doesn't want him making her medical decisions for her. We have same-sex couples who, in the eyes of the law, are considered a close friend if they're not married. So the person that knows this patient best may be at the very bottom of the list to make decisions, and in some cases just may be left out altogether. Now, another important situation to note that we see here in Florida is grandma's on life support before anybody could talk to her, but her Social Security check is funding an entire family. Who's making decisions for grandma now? And is that what grandma would have wanted? So you can see the importance here in having a healthcare surrogate and not leaving it up to a designated proxy. And you're going to see why as we go through this presentation that it becomes really, really important. So what makes a good healthcare surrogate? They need to be able to do this. Yes, ma'am?
I just wanted to ask, if you have durable power of attorney, then do you still need a healthcare surrogate in Florida?
It depends. It depends. She's asking if you have a durable power of attorney, if you still need a healthcare surrogate. If you have a durable power of attorney and you have been given the right to make medical decisions, you don't need a healthcare surrogate. You've kind of already got that covered. The difference is usually you need to pay for a durable power of attorney. But you bring up a really great point, and that is, what if you designate a healthcare surrogate and then you have somebody else as your power of attorney? That's going to be a problem. You don't want to have conflicting powers of attorney and healthcare surrogates. So if you make someone your power of attorney, either don't make them your healthcare surrogate or give it all to them. You don't want to have two different people. That's going to be a problem. Good question. They have to be willing. You all have to be willing to want to do this for someone else. Okay, it's the worst thing ever. I worked in a hospital a couple lifetimes ago, and it's the worst thing ever to have to call a healthcare surrogate and say, Mrs. Smith, I need you to come in. He's not doing so well. As his healthcare surrogate, you need to make some decisions for him. And they go, I'm the what? I'm the what? I don't know what that is. I hear it all the time. People will designate someone as their healthcare surrogate, and that's as simple as writing down their name, address, and phone number on one of these pieces of paper, but they don't share it with that other person, which means you haven't asked, are you willing to do this for me? It's a sacred role. It's an important role. You can't just assume someone wants to jump in here and do that. I do private facilitations with families, and we sit around the table, and I'll say, Mrs. Smith, Mrs. Jones has designated you as her healthcare surrogate, and Mrs. Smith will say, I thought I was just her ride here today. It happens. People feel uncomfortable about this, but you got to make sure if it's you asking someone else to be your healthcare surrogate, are you willing to do this? And if you're somebody's surrogate, obviously you're willing to do this, or you wouldn't be sitting here listening to me. Preferably local. Not always. I understand that oftentimes our families live in other states. But there's a place on most living wills where you can have an alternate surrogate. Not a bad idea to have a surrogate and an alternate, so that if the first couldn't be here, the second can do that. Better to have somebody local, and then, if you have that family member out of town, that's fine. They can't be intimidated by hospitals or physicians. This is not the person who's just so warm and sweet and loving in your family and you just love them to death. It's probably not the good person to have as a healthcare surrogate. We're looking to be strong, to be an advocate, to be able to look a physician in the eye and say, this is what my loved one wants and this is what they're going to get. People that are very sweet and loving, God, our families need them, don't they? But they can be easily intimidated by the healthcare system, hospitals in general. They're not always the best choice. They're good choices for other things, but not always for good healthcare surrogate. So you all need to not be intimidated by physicians and be able to ask those important questions. Somebody who will follow your wishes even if they disagree. I'm going to hit on this several times throughout this presentation. A good healthcare surrogate can carry out a person's wishes even if they disagree with them. That would be me saying, Mom, I don't agree with what you want. It's certainly not what I want, but I'm going to honor your wishes because this is about your health care. This is about your body. So a good healthcare surrogate can say, I will follow your wishes even when I disagree with them. That's not easy for everybody to do. Able to ask questions and make decisions. I am not a good decision maker. I will admit it. I can't even decide on the color of the pillows on my couch. I do this for a living. I know it frontwards and backwards, but I'm not a good decision maker. I'm very analytical. I'm very type A. I want every T crossed and every I dotted. It's not a great decision maker. So you want to be that person that can make a decision, can say, look, this is somebody's life we're talking about. I need to be able to decide what to do. Is aware of your wishes and values because you have discussed them. If you all are somebody's healthcare surrogate and you have not actually discussed how they feel about these things, and not just about, yes, I want CPR, or no, I don't want a ventilator, and all these other things, but about their values and what they fear and what they're worried about, you need to do that. You need to do that because that's all the ammunition that you'll be gathering to be able to make decisions at some point in the future. And the time is now to do that. And again, a strong advocate. This is very much an advocate role. Not just the doctor comes up to you and says, okay, what are we going to do about your husband, blah, 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 and you recite something. It's not just that. It's about you being able to step in their shoes and make those decisions for them. The superhero. That's what I call them. These are the superheroes. You are all, you've been branded today, superheroes. Pick which one you want to be, but you are them. Because this is not an easy thing to do, and this is somebody that you have to have some level of strength and authority to be able to do this. A good healthcare surrogate knows the patient well and understands what's important to him or her. Not just about decisions for these end-of-life treatments, but all the values, the spirituality, and the culture that goes behind it will all come into play in making decisions for someone. He or she must be prepared to respond with conflicting opinions between family and the medical team. This person is the go-between, the smoother outer, the person who can take the information that's being spoken sometimes by 2, 3, 4 healthcare providers and is able to internalize it and regurgitate it to the family and take those family questions and issues and take those back to the healthcare physician. It's not always that easy. But that person is often the intermediary between all that because the healthcare team typically doesn't want to talk to an entire family. Usually they want a representative, somebody that's calm, level-headed, and they can have a good conversation with. I see a couple heads nodding, so I know that you all have probably experienced this already. So what does the surrogate do? They do a lot. They obviously can make healthcare treatment decisions. They can take steps to see that they're honored. What do I mean by that? I mean being able to be vocal, being able to ask for administration if they need to. All the things that they need to do to make somebody's wishes honored. They can talk to the doctor or the healthcare team. In these days of HIPAA, this is a very important thing. That you can designate, or you've been designated as a healthcare surrogate, now you have the legal right to talk to a doctor. Can authorize treatment or have it withdrawn per the patient wishes, and we're going to talk about situations that you may find yourselves in when you're making a decision that might go against what's in a living will, because there's nothing completely black and white here. There are a lot of gray areas, and we're going to hit that in just a minute. They have access to medical records. As a healthcare surrogate, you can say, I need to see my loved one's medical records to make good decisions here. What's happened in the past? What medications have happened? Can authorize transportation to another facility. This is very, very important. Here's an example. A patient is in a hospital, perhaps a Catholic hospital, that says, we do not remove patients from artificial nutrition. It goes against our regulations. And that's fine. Every hospital, every health organization has different regulations. You as a healthcare surrogate can say, she doesn't want a feeding tube. She doesn't want this. And the administration is saying, well, our policy doesn't allow us to take her off of that. And you say, what do I do? Do I just crumble to the healthcare organization and go, well, what am I supposed to? No, you can move them to another facility. And you can move them at their expense. That's really important. If you're not getting the care for your loved one that's needed, move them somewhere else. You have the authority to do that. Yeah.
In that particular case, what would be the possibility that somebody else, a close relative in the family, says, well, I disagree with that, and go to a judge and try to...
You can't stop that. They can do that.
They can do that.
They can try, but there is no reason for a judge, if you've been designated as a healthcare surrogate, this is just for example, and say your brother says, I disagree with him, I'm going to a judge because I want this judge to follow my point of view. If there's no reason for that judge to think you're abusing your powers as a healthcare surrogate and that you are following the wishes that have been designated, the family member won't have a leg to stand on. Now the problem is those things take time and they can hold up the works. And that's why I'm here to tell you, we don't want our family members in court. We don't want it to ever have to come to that. Usually when those things happen, it's because a family member was left out of the decision-making process. They haven't been kept up to date with some consistent information. And when people are not heard, what happens? They start having a temper tantrum. I get phone calls. This is a similar situation. There are a lot of daughters caring for their elderly parents. Their siblings have gone off in the world and started lives in other states. And so daughter is here in Florida taking care of dad, having a lot of conversations and a lot of interaction, knowing exactly what he wants and doesn't want, and he takes a turn for the worse. And then her brother flies in from out west somewhere, and he hasn't seen dad in several years. And he's shocked when he gets here. And he goes into a real emotional turmoil, and he doesn't like the way sister's been caring for him. He doesn't like the decisions that she's making for him. And so I get a phone call that says, how do I sue my brother so he doesn't take over this role? So you don't want to sue your brother. You need each other. You need each other right now. You just need to bring him up to where you are. There's shock and there's hurt and there's pain going on that needs to be addressed. And sometimes you might need some help getting that person to where you need to be. Everybody defaults with the attorney. We're going to get an attorney so he can't mess this up. I hear it from my senior populations when I give presentations. They say, how can I make a living will that my kids can't screw up? I'm like, you can't. You can't. They can screw it up every single time. But what you can do is you can start a dialogue to get them to where you need them to be. Okay? That's really, really important, that communication piece of it. Stop looking at that relative who's the fly in the ointment. Stop looking at them as just a insurmountable problem, and start finding a way to bring them into the folds and where they need to be. Because then you can move forward. But great question, thank you. Okay, a couple more things. They can authorize admission or discharge, even against medical orders. The hospice that I work for, this happens quite a bit. Patients in a hospital, and in order to get their wishes honored, sometimes that healthcare surrogate discharges them from the hospital and puts them into hospice, because hospice can honor those wishes. So it's just another thing you can do. It's another responsibility. They can apply for for public benefits such as Medicare and Medicaid. As a healthcare surrogate, you have the authority to apply for these things for the patient. Authorizing participation in medical research related to the patient's condition. You can do that. You can authorize that. Deciding about organ tissue donations. Let me caution you about this one. As a healthcare surrogate, you can make that designation for someone, but have that conversation. That's a very personal decision about organ donation, and it's a very simple conversation to have. How do you feel about this? How do you feel about your organs being donated? How do you feel about certain? I mean, I've seen living wills where people have written things in there about organ donation, and they'll say everything except whatever. I saw one not too long ago that said everything but my eyes. I don't know why I didn't have that conversation with that particular person, but that was their wish, to donate everything but their eyes. That's your right. It's your right to do that. It's your body, it's your right. So have that conversation with somebody that you're the healthcare surrogate of and say, let me know. What do you want? In someone else's shoes. If you think about your role as a healthcare surrogate, picture you walking around in their shoes. You are carrying out wishes that they already made as if you were making them in their own body, in their body. Okay? It's a whole lot different, and I'll tell you what, it'll be a whole lot different for you when you realize and understand that you're not making decisions to end somebody's life by being a healthcare surrogate. You're honoring the wish that they already made. What you're doing is you're carrying out for them, you're being the mouthpiece and carrying out for them things they can't do. Because that living will only comes into play at end of life. Okay? Do you see where that's a whole different way of thinking about this? I gave the example earlier in my earlier presentation. My grandfather died about 12 years ago, and my mother was his proxy. He didn't have an advance directive. He didn't have a healthcare surrogate. And so my mother had decided to remove him from life support. And to this day, she will cry on a dime about that decision, because she feels like if she'd have just given him one more week, he'd have gotten better. He died, he was 87 years old. He died of old age. They couldn't even find anything to put on his death certificate because there was nothing really wrong with him. He just petered out. And he wouldn't have gotten better. But they never had this conversation. They didn't talk about anything. He never told her when enough was enough. And so she carries that guilt with her like it just happened yesterday. And she will cry like that. We don't want that to happen. We don't want that to happen to you. We don't want it to happen to others. Okay, so let's look a little bit at your legal role. Clearly defined as providing information on what you think the patient would have wanted when a medical decision is contemplated. That comes right out of our statutes in Florida. And basically what they're saying is you have to make decisions as they would make those decisions. The other way, when you make decisions as a proxy, when you've just been given that role, not chosen for it, you are making what's called a substituted judgment. You are saying, well, if that were me, I would do this. But in this role, you've been chosen to do this. You've been chosen to be somebody's voice. You would do it as they would want it done. Because the patient can change his or her mind, the healthcare surrogate can change his or her mind. A lot of folks don't like this. They say, well, can my healthcare surrogate go against my wishes? Why, yes, they can. They have to have a reason for that. But what in essence happens, the law gives you the right to make medical decisions for somebody as if you were them. They could change their mind. So the law gives you the right to change your mind. And here's the example. So mom is in the hospital and she is on life support. And daughter says, if she codes, in this particular instance, she would want CPR. And the doctor says, well, her living will says no CPR. And the daughter says, well, I know from a conversation that I had with her that because this was induced by flu or some other situation, we've had a conversation and I know in this situation she would want CPR. And they're going to say, okay. She has a compelling reason for why to change that decision. And it's hard for people to accept that because you want everything to be black and white and in writing exactly as you want it. But because you can change your mind, the healthcare surrogate can change their minds as well. And that's why the decision of a good healthcare surrogate is huge. Okay, so however, there's one important difference. And that is the healthcare surrogate's legal and ethical responsibility is to express what the patient would have thought about any medical treatment. The surrogate cannot express what himself or she herself would want. And again, that's right out of the statutes. Perhaps the most important reason that surrogates have this right is because patients frequently change their minds. We see it in hospice, even in folks' last few hours of life, they change their minds. We have 3 inpatient units at our hospice, and we have 911 calls made all the time from those units because a patient changed their mind and didn't want to be a DNR, and all of a sudden said, nope, I want to give this one more go-around. Happens all the time. We are thinking a lot of things when we're not feeling well. So our minds change. So it's real important that we check in with each other. That when you're a decision maker for somebody, that you check in with them about, do you still feel the same way about this stuff? We need to talk about this. Be prepared to discuss your reasons with the physician. If there's some reason that you're making a decision that's against what's on the living will, you need to have some compelling reasons. You can't just go in and go, nope, I didn't like that decision, I'm going to make a different one. There needs to be a reason for that. If the patient has decision-making capacity, it doesn't matter what the surrogate says. If a patient can sit up and write a word out or tap on a pencil or blink their eyes, if they have a way to communicate with their physician, the patient is always the one who's in charge. Okay? As a surrogate, you only have that right to do that after 2 doctors have said there's little or no chance for this person's survival and they've lost the ability to communicate. Okay, that's when your role as a healthcare surrogate comes into play. I love this quote by George Bernard Shaw. The single biggest problem in communication is the illusion that it has taken place. We haven't had enough communications about these things, and we're going to take a look now at ways we can do that to get in a better place. So what if you're unsure of what those preferences are? Certainly now's the time to start preparing. We want to prepare with people when they're healthy, when they can share with you what their values are, what their goals are. These are thoughtful conversations. Not scary. I call them kitchen table conversations. Sit down with a cup of coffee or a cup of tea and say, let's talk about these things. Learn what is important to that person. So here's some of the things that we need to know. How would he or she like to be cared for? Okay, in a living will, we tend to think it's all about what we don't want, but there may be things the patient does want. So you need to know not only what they don't want, but what would they want, and for how long. My living will has what's called time-limited trials written into it. Right now, at my age, in my current situation, I've said, these are things I'm willing to try for a little bit of time. I'm not willing to be on life support for 15 years, but perhaps a few weeks is okay. It doesn't have to be all or nothing. You need to have that conversation with somebody and say, you know what? Would CPR be okay with you? One go around or two go arounds? It doesn't have to be an all or nothing. Discuss quality of life, and we're going to look into that a little bit more. What is important and meaningful? Quality versus quantity is huge, because we all have very different feelings on quality versus quantity. And what might mean a long time to me might not be long to you at all. So here's some helpful questions to help you get started. I like these questions because they're very open-ended and allow people to open up and talk to you about these things. What is important to you at this time in your life? What a neat question to ask. Well, right now, family is very important to me. Right now, sitting here talking with you is very important to me. Maybe 2 years down the road, what's important to me at this time in life is breathing with not hurting or not being in pain today. You see how that question can open up a lot of things. What fears or worries do you have about your illness or medical care? A really terrific way to find out what people know and don't know, or feel and don't feel about their medical condition, is ask them what they fear. What are they worried about? If you had to choose between living longer or quality of life, how would you approach that balance? How would you approach the quantity versus quality thing? What sustains you when you face serious challenges in your life? I love this question, because this can develop into a spirituality conversation. For example, when your loved one gets very sick and they're not able to communicate with you, do they want a rabbi there? Do they want a pastor or a priest available? Is there a special friend that makes that person feel very calm? What are those things that sustain you when you face serious challenges? It's a great thing to know about the person you're making decisions for. Do you have any religious or spiritual beliefs that are important to you? What a great way to know who is that priest? What's his phone number, in case I need to call him? How can I make decisions that may end the life of someone I love? This is like the proverbial question when you're a healthcare surrogate, right? You have to make that decision. But what I want you to do is I want you to reframe it in your mind. You're not making the decision to end the life of a loved one. You're carrying out a wish that's already been made. By completing a living will and somebody documenting the things that they want and don't want, they've already made the decision. They've had a conversation with you so that you know what those things are. You aren't making a decision to end a life. You're honoring a wish that was already made. And I say, it's the disease that is ending my loved one's life, not the decision to withdraw or forego a treatment. Okay, so there's a thing called decision maker stress. There's been lots and lots of research done on decision maker stress, and I want to talk about a few of those. And so just know that it's normal to be stressed and uncertain. You're not alone. There are many places to go for help. Unsureness about a patient's preferences is probably the #1 reason that we as healthcare surrogates get stressed. So planning ahead is really important. Having this conversation early is really, really important. Discomfort with the hospital environment. Nobody likes to go to the hospital. I mean, don't you feel very small in a hospital? You feel like everybody's hustling and bustling and going by and you can't get answers to your questions. So what you can do is you can ask for a patient navigator or a chaplain or a social worker. These are people in the hospitals to help families, to help caregivers, to help healthcare surrogates navigate through some of this. Just kind of stop the insanity. Say, I need help. These folks are there that can help you. The logistics in decision making. When do I do this? When do I sit down with my loved one? Give as much time as possible. These are things we need to do. Living wills need to be done by everybody. How many of you in this room have one? Most of you. We need to do this now. I do presentations at the local universities because I want 18, 19, and 20-year-olds to do a living will. This is not a sick person's thing. This is a person's thing. Okay? So the sooner the better. Poor communication by clinicians, boy, haven't we all experienced that? They're in, they're out, they might be there for 30 seconds, you forgot what you wanted to ask them. Regularly scheduled conferences. You have a loved one who's in the hospital and they're going to be there for a while. You get regularly scheduled conferences with this physician so that you can tell the other family members or anybody else who needs to be there, the physician's coming at 6 p.m. today, come with your list of questions. And make that happen regularly. And you might not have that individual who says, wait, nope. Include the family in those conversations. Conflict among family members, you won't be able to stop it, but you might be able to mitigate it by keeping the communication with them consistent. Report back. I met with the doctor today. Here's what she said. Here's what we're going to do. As per Dad's living will, this is what we're going to do. Okay? That sense of sole responsibility on life or death situations, that can be a hard thing to carry around because you're the voice, you're the decision maker. Talk through these options and make recommendations. Do you see the theme here is communicate, communicate, communicate. Uncertainty or guilt over the decisions that you make. And express support. You're not only the supporter, but you need to be supported as well. And you need to feel free to ask for that. Like, look, family, I'm doing the best job I can. I could use a little support here. What to do when your loved one can't make decisions. So what is the game plan here? What do I do? Oh my gosh, okay, now I'm a healthcare surrogate. What do I do now? Make an appointment with a physician. Let him or her know you're the healthcare decision maker, you're the family voice, you're the one that's going to be having the conversations with them. Make yourself known as that healthcare surrogate. Make sure the living will's in the medical chart. Somebody in my earlier presentation said, oh, I get asked if I have a living will all the time, but they never asked to put it in the chart. It's like they check off a little box that says, yes, this patient has a living will. Well, what good is it if it's not in the chart? So we need to make sure you have a copy of it as a healthcare surrogate and that you have some copies because you'll probably need to share that with the hospital. Try having conversations with your loved one. If it's gotten to the point where you're asked to be a healthcare surrogate, oftentimes your loved one's already unable to make those decisions. But anytime they can, try to have those conversations. We see in hospice all the time that patients have good days and bad days. Some days they're really good making decisions and other days not so much. Keep them in the loop. Advocate on your loved one's behalf. You oftentimes need to be that strong presence, that strong advocate. So here's a few strategies for getting some support. Loved ones who have conferences with physicians are less stressed, anxious, and depressed. And you see up there it says less likely to have PTSD. There's some really strong research out there that shows loved ones who didn't know what the patient would have wanted experience PTSD. That's huge. It's probably what my mom's experiencing, post-traumatic stress disorder, because they didn't have a conversation and they didn't talk to each other. Ask for ethics consults. Has anyone in this room ever been involved in an ethics consult? When I ask this question, hardly anybody ever raises their hand. Let me tell you, every hospital, every nursing home, every long-term care facility has an ethics committee. It's probably the most underutilized resource that we have as caregivers. The ethics committee that I'm a part of at hospice, includes doctors, nurses, clergy, people from out in the community, not just internal. But it's a great group of people that can take a problem and dissect it and give some really good advice. And say, you know, we have a problem here. My family's having a really rough time. I have someone who says that, you know, they want the decisions made differently. Say, can I have an ethics consult? I love that. Because that means we're trying to all work together and come to some resolution. You don't have to take the advice of an ethics consult. In fact, we always say we're not here to tell you what to do. We're just some professional individuals that have had some experiences that we can share with you to give you a little bit of background and history to help you make some decisions. Yes, sir?
As far as the ethics consult, is that similar to like an ombudsman as far as the care, or is that more of, we're making this decision, we'd like a little bit more expertise on it?
It's similar to ombudsman, but ombudsman is a little bit different. An ombudsman is more of an advocate, more of a strong advocate to help you with the patient, where an ethics consult is a team of professionals that have nothing to do with the care of that particular patient. Kind of when you want that unbiased opinion, when you want a group of people who could say, okay, we have a 68-year-old patient who's blah, 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 blah. And then this ethics team of people can say to you, in our unbiased opinion, here's what we would say or do. Where an ombudsman is more about, they find out the details. They want to know what's going on with that particular patient. It's more of an advocacy, but they're great resources as well. They are. I just know that as part of an ethics team, it's so underutilized, and I don't want you to feel that you can't use that resource for yourselves, because it's oftentimes so reassuring. Ask for assistance from a faith professional. They also go very underutilized. Every hospital, hospice, assisted living facility, they have chaplains available that can be very, very supportive and helpful. Don't be afraid to bang a few tables. I say it all the time. These are the table bangers. You guys are the superheroes. You got to be a table banger to be a good healthcare surrogate. So are you ready? Can you do this? What do you think? My organization provides services for individuals and professionals, and we also do a lot of private facilitations, so we do this quite a bit. All of these services, even though you might not live in my area, are available to you. We can mail you things. We're happy to talk to you on the phone. Our services are provided free of charge. We have a website where you can find some of this information. Please use us as a resource. The purpose of our organization is to educate and empower people to communicate and document their healthcare choices so that their wishes are honored. As you can see, we're part of a very big organization that includes all of those organizations. So here's what I want you to take away with you today. As a healthcare surrogate, you've been chosen. It's a sacred role. It's not just a fly-by-night silly thing. It's a very sacred role when somebody asks you to make medical decisions for them. Remember that you're wearing their shoes. You are in their shoes, making decisions as they would make them. There is support for you. Don't be afraid to ask for it. Okay, the last thing I want to do, and then I want to share one story with you and you're all done. The small booklet that I've given you, and there is plenty of materials left. If you came in late or you want additional ones, I have plenty up here. This book about what do I do now, the healthcare surrogate, this was created from a research paper that was written that talked about the top 10 stressors that people face when they're making decisions for somebody else, medical decisions. And so we wanted to create a handout that would address some of those situations. So basically, this is like a healthcare surrogate's handbook. Okay, we wrote this in-house. Me and one of the members of our chaplains, one of our chaplains wrote this together. And I think you'll find this very helpful. The other two documents, I handed out in my earlier presentation to the ones that were attended by the patients. Everything you need to know about a living will and healthcare surrogate is included in this booklet. So if you haven't done your own living will, there are 2 in here, and all the information to get you started. Okay, and this small handout was given out to them about making healthcare decisions with a serious illness. It's another brochure that we created internally. Okay, one final story, and then and I'll let you go. So one of my favorite presentations that I gave happened to the Pinellas County Sheriff's Office. This was a presentation, mostly retired police officers. And a fellow in the back raised his hand and he said, in my family, we throw a kick-the-bucket barbecue. And I said, a kick-the-bucket barbecue. I am real curious about what that is. Tell me about this kick-the-bucket barbecue. And he said, well, he goes, every 2 years, he goes, my wife and I throw a barbecue. And we invite our 4 children. Our 4 children are all married, and some of them have children of their own. And he said, we get together and we all get in the spirit of it. He goes, we decorate with black balloons and streamers. And he said, my daughter makes this big cake with a bucket on it. And he said, it's all fun. And he said, it seems like every couple years it gets bigger and bigger as we do it. He said, then after we enjoy our barbecue, he said, we go into the living room and we all sit around. And he said, my wife and I have shared with our children what's in our last will and testament. So all these children know exactly what they're getting. Who's getting what? And he said, we've even allowed them to trade a few things. He goes, well, why do we care? You want grandma's watch, I want grandpa's ring, we switch them. And then we get out our living wills. And he said, and in our living wills, my wife and I's they're very different. Things that she wants and doesn't want aren't the same as what I want and don't want. Our children know who is our healthcare surrogate and then who it's not, and what our wishes are. And I thought this was huge. And this man's story made a huge impact on me for 2 reasons. One, this family made it very normal to do this. It wasn't scary. It's something they did every couple years. Why? Because things change. So it was very, very normal. And the other part of this, which I thought was incredibly moving, is that their children were there. And even though they may or may not have understood everything that was going on, they saw mom and dad and grandma and grandpa having some serious conversations about healthcare, and nobody went running from the room. And probably those children will grow up and have those same kind of conversations with their families. And I thought that was huge. So go forth and throw a kick-the-bucket party for your loved ones, for yourselves. It's the right thing to do. So thank you so much for your time. I appreciate your attention. I know you're tired after that big, huge lunch that you had. I'm going to be around if you have any additional questions that you'd like to ask or if you need any additional materials. So thank you so much.